Ladies and gentlemen, welcome to another edition of FLUX360. Yes, this is the show where we talk sense in the most fun way. We'll make it humorous, we'll make it relatable so that you can enjoy it. And we're here to do another episode that is going to be very, very educative, informative, and of course we try to have fun in whatever way we can. Of course it's me, yeah, the new look. I know, come on, I know. It's still Evelyn Ohiola right here on FLUXITV. And you know, I do not do this alone. I do not fly this plane alone. My co-anchor is here. Heritage.
Hola.
How you doing?
I'm good.
Okay.
And you?
I'm alive and well. God has been faithful.
Yeah, God has been faithful.
He has been
even though the situation of economy and everything, but God has still been faithful in our life. And glory be to God. We are here again to drop our 2 cents.
Yeah, I mean, the best thing you can have is you having good health, because I know good health
Definitely.
is underrated
Very
in this part of the world. And
even if you have money, you can't still solve it.
Exactly. So we thank God for good health, because if you go to the hospital, you see people that just want to have that good health that you have. Just 5 minutes of the good health that you have, they just want to feel relief, they just want to feel fine. So in whatever situation you are, try to thank God. You know, when they say when there is life, there is hope. And God will do am before, go still do am again. So calm down. All right, on today's show we are going to be looking at something very important. In fact, I can say it's the most important journey in a woman's life, and it's something that is also not just important to the women folks but also to everyone, because we all passed through this journey in one way or the other, whether you were the bearer or you were born. Anyone, I don't even know what I'm saying right now, but what I'm just saying is that we all have passed through that journey, because we all came through a woman, and that is talking about the pregnancy journey of a woman, the pre and postnatal journey of every woman. We're talking about motherhood today, and motherhood,
it's a lot.
See, I visited a friend recently. She's a first-time mom. Her child is just 2 months, and when I got to her house, the moment I got to her house, she was doing something from one thing to another, to go and do this, at one point she just carried the boy, just go and dumped him with his father. I said, no, be only me born now, take care of your child.
Both of us.
Because she told me that, see, Evelyn, I can't lie to you, it's not easy. She said before she got married, she always wanted twins. She said, thank God does not answer some kind of prayers.
So those who are twins and called triplets.
She says it's not easy, that it's a job on its own. Motherhood is a job on its own. And this is a shout out to all mothers out there. You all are doing a fantastic and fabulous job. I used to tell people that every day should be Mother's Day, because it's not easy. So to help us talk about maternal care, the conditions that happen during pre and postnatal, there is no other person to discuss this better than someone who is in the field, and I call them heroes. Yes, heroes of this journey, because they are the one that ensure that the mothers and the children are safe. We have on the show this beautiful day Matron Beatrice Adegoke-John. She is the Chief Nursing Officer at Oyomesi Specialist Hospital in Orogun, Ibadan, Oyo State, Nigeria, Africa, worldwide. Welcome to the show.
Give you flowers. Thank you for the effort and everything you've been doing.
You're doing an amazing job. I should first say that.
We really appreciate that,
because it's not easy taking care of. If mothers can complain of the job they are doing, now let's look at those people that are taking care of them and the kind of job they are doing. Before we delve into maternal care and all, I want to ask you, what pushed you to want to go into say you want to be an officer, a health officer in the maternal care, to be a midwife? What pushed you there? Was it a thing of passion, or it's something you've always wanted to be, or it's just something you just stumbled on and you just came to love it?
Thank you very much, Madam Evelyn. Heritage, thanks for having me.
You're welcome, ma'am.
Oh, what pushed me into this? I remember when I was in SS1, my teachers used to ask me then what I would love to become. Surprisingly, that day, I just told one of them that was so concerned about me. I told her, I want to be a nurse. She looked at me and she was like, nurse? Why not a doctor? You know that mentality there. You'll be like, oh, you want to be a doctor?
Yeah.
No, a nurse. Sincerely, truthfully, I didn't know what made me say that, but I said it with all convictions, and I meant it. But along the line, my mother used to be a teacher, but after 10 years of working with the government, she resigned, and we relocated, and they were referred to as missionaries to where we relocated then. And then my mother went into health sector. She went into health line. She went to learn about it. Initially, she started as a voluntary health worker. Then she improved herself. She improved on herself and went to school, went to get some, to take some courses, and she went fully into it under a church. And I see my mother take deliveries day and night. I see my mother pray for pregnant women. I see my mother go to the kitchen to put on something that patients will eat after she's done taking the delivery. I see her do a number of things for strangers. And I was... A particular side of me is afraid of that thing. I'm scared. I don't want to. But another side of me gradually draws closer to it. Oh, no. She was and she is, she's still alive. Passionate about it. And she actually grew in it. And the truth be told, before I finished secondary school, I've been widely exposed to it. So the passion gradually grew from there. After I finished secondary school, jammed me several times. So, I can see that. No. So when I did 2002, I couldn't stay at home again. I've had my first 5 subjects and all. I couldn't stay at home again. So I went into animal health and production, myself and my immediate younger brother. So went to animal health and production, and upon plantation, I did animal health and production. I remember the day I graduated. My mother looked at me and she said, permit me to use my local language. She said, because then I will run away from cats. I will run away from rabbits. I couldn't hold N. She was like, so eventually we went and said, I want to be. So we kept on with it. Fight and all. So in 2006 I gained admission and I went into my school of nursing. When my colleagues were serving and were done with their, that was when I was just starting, because I was hell-bent. Nursing or nothing. So I went into it. So that the passion from there, it began to grow the more. I was more knowledgeable. Then I started knowing why my mother was doing some things. So okay, what she could improve on. Whenever we have a break and I return home, I want to share a number of things with her, So when I was done with that, as I was running up, I got married. At some point, when I was done after having first 2 children, I went back to school, maternal health and production. I want to be a midwife. I want to know more. When I was done with that, family as a woman and all, and when I was at some point, I went back again. I want to do my BNSC. I just want to know more. Anything that will make me do well and give well to mothers, I'm in for it.
Wow.
So it's kept on growing, and we bless God for where we are today. So that was how it started.
Wow.
Wow. That's impressive.
Thank you.
Over 15 years of experience.
Yes, please.
You have given so much. Looking back at the things you have given, looking back at the number of deliveries you've, helped women have.
Can you even count it?
Looking back at the times you look at newborns and you look at how they, into their eyes, and you see the innocence, and you see how small they are, and you see how wonderful God is. Looking back at all of those times, for you, what would you say is it for you? That moment that it was it for you, I knew that, no, Beatrice, you're doing a wonderful job.
I find fulfillment in it. Seeing mothers come out fine out of, delivery, the cesarean section or vaginal delivery, seeing these babies grow, when they come back for infant welfare clinic immunization, and I see them doing well, sincerely. It's more than anything to me. I am telling you. I always say this, let mother and child live. You know, why would somebody's life be claimed because another life is coming? That thing gets at me a whole lot. You know, at times in the presence of as we discharge our duties, sometimes when we have mortality, it's rare though, but sometimes you would have it. At times when we have mortality like that, you know, it's a whole lot. It's a whole lot. That is why I am all sold out to the preventive aspect of this. What can we do before we get to that stage? What can we do? This makes me, you know, so passionate about the teaching aspect. I want to teach it. I want to preach it. I want everybody to know. Nobody should be ignorant. What can we do to save the life of this mother? What can we do to save the life of this baby? What can we do that eventually at the end of the day everybody is happy? The bundle of joy does not turn to bundle of sorrow. You know, a lot happens. So I am all sold out to ensuring that every woman is empowered with the right knowledge that will make them have a good outcome of the journey of pregnancy, because it's actually a journey. Yeah. That's why in Yoruba land, where you give birth, they say it's actually it's you just pass through that danger zone, and it's a great one. And before we can say yes, you've actually passed through that danger zone, you would have passed your postpartum period. That is 6 weeks after delivery. In Yoruba land, once again, ojo 40 days, that's 6 weeks after delivery. Then we say, okay, postpartum, okay, you're fine. You have actually passed through that danger zone.
Oh, okay, so the ogojo, that's why people don't go out.
40 days.
It's actually postpartum. We call it this postpartum period. That's from day 1 after delivery till 6 weeks. Because anything that happens to that woman within that period could actually be related to delivery. Yeah. So when that period passes away, we say, oh, okay,
anything that happens
after, you know, it may not be related, but most within that 6 weeks, a number of things can happen to that woman.
So, but why do our parents, why they like giving birth? We all know the danger in it, and they still give birth to like 6, 7, 8 children.
Thank you, my sister. God bless you.
We all know the danger in this thing.
I used to have a patient, you know, after she delivered her first child. So she was all expectant, waiting for her mother-in-law, waiting for her home mother to visit in the hospital. And immediately they came, she was like, Ma, you people are wicked, oh. Please, was that what you went through? And you had, I have a sister that the mother had 13 children.
What?
Yes, please.
Yeah.
13 children, Yoruba woman. And she was like, hey, she just gave her to 3 and said, I am done. What?
Yeah.
She gave birth to all manners of children. Ojo, I know. You know, baby that will come with hand.
Yeah.
Baby bleach, presentation, transfers, twins. Mention it. Just like, but the truth is, we can't compare our life now to then. In those days, by the time you put to bed, a number of people, in fact, they are keen to come around to help you. Yeah. But all those things are gradually phasing. Everybody is busy. Everybody is not, in fact, you're not even in the country whereby you have somebody around to help or assist. A number of things are actually gradually creeping in that is not helping in that. So we can compare our life now to then. I used to have one of my siblings. He gave birth to 1 child and stopped. Said 1, and that's all. My mother started begging, I'm fine. I said, oh, Mama, mommy, you know, we will joke about it, but the truth is, now, no, the assistance is not there. Everybody is busy. Improve technology, a number of things. There are several factors. The socioeconomic factor is well. I don't want to say things are not getting better. Okay, I remember when I gave birth, the amount I bought my firstborn, the price for the pampers, the diapers I used, you know, this one I just diaper, so amount. And the truth is, we are discussing it now, 2025. Yeah. In the next 10 years.
What's it going to look like?
Thank you. So a number of factors put together. Besides, then most of our mothers, they were not, permit to say, they didn't go to school that much. Yes. You can't, you know, I just told you my story. I waited so period before I went to school, because I was determined that is what I wanted to do. If it happened, if I'm not among the elites, or maybe my environment will affect me and all, I may just like, let me just go and learn one handiwork 2 months, 6 months. After then, Ili Okoya, and I start giving birth. So by the time, most of the time at that marriageable age, most ladies are still looking for admission. Most ladies just enter school, and a number of things like that. They can't stand on their own yet. So by the time they are starting to raise children, they are already in their 30s. The age thing matters in the delivery for women, compared to men. You can be 80-year-old and you choose to remarry tomorrow. So be it,
I still father a child.
But to the lady, it doesn't happen. So a number of factors. Besides, it's not healthy.
When you say healthy, what do you mean?
Thank you. There are several factors, factors that can be put together that determine the awareness of a woman in pregnancy. For instance, there are some women that with their health condition, in fact, permit me to say we help them determine the number of babies they should have if they really want to have their life. And besides, we do not come to this world to give birth alone. No. There are several other things that we could achieve. So we need to, because you don't just give birth, keep giving birth, okay, at the end of the day you have 23 children. You may have the money, but it's beyond money when it comes to taking care of these children, raising them up. That is it. They have the passive phase of life, their active phase, the formative period of life. You're not there, you're not available. That is busy, mommy is busy, nobody is raising those children. At the end of the day, we have insufficient vagabonds in the society. Because so it's beyond that. You bring your millions, drop it. You just talked about your friend now that you went to visit. As you went to visit that woman that day, you could have just dropped billions of money on their table and let the mother go to sleep. Let daddy go away, drop the money on the table, leave the baby beside the money. Who takes care of it?
Exactly.
There's several factors put together that needs in child raising. Child raising is beyond you. Congratulations. It's beyond put it to bed. No. It's beyond put it to bed. So there are several things. If you actually want to have a quality child, which will bring good influence to our community, to our society, to the country at large, we need to be very careful in the number of children. Not in pay or
But you know that it is these people that don't have, like those people that are not financially buoyant, they are the ones that give birth to 10. They give birth to you be one, and they will tell you that what do they say?
Exactly. That's one of the things they say.
Yeah.
If I not born everything, though, it will become big fibroid and sit inside my tummy. Who tells them that? Most of the time, ignorance.
Yeah, true.
No, they're not knowledgeable. True. You know, I said earlier on, I love to empower women, sincerely. Empower them with what? Knowledge. I'm not even talking about money. Empower them with knowledge. You can, if you are knowledgeable, it will help you plan a number of things. You can have the money. For instance, I've met with women that they are buoyant. I examined one recently, and after my examination, I realized that the child was already stunted. And she's well to do, but she does not have the right knowledge of what I want to put together to make the baby feed elderly. She has that money, but she doesn't have the knowledge. By the time I took my history, used my mark tape, check everything, I said, over 1 year old baby, this baby is taught. You would think she's back in 3 months old baby. Yes, please. And she has the money. Then when I saw that deficit, wow, I sat her down and it started. The teaching, the empowerment, the training, demonstration, and a number of things. And I gave her a follow-up. Because this baby, because gradually, if you is not going where it could affect the cognitive, the first 1,000 days of a child's life is the most important.
1,000 days? Yes,
please. To that child, to the brain development. Under the first 1,000 days, that's by the child from day one of conception till the baby is 2 years old. I'm telling you. And by then, about 72% of the brain is developed. As if you go for an exam and you score 72%, is that not an A?
No, that's an A.
Distinction. So, a knowledgeable woman will want to do everything to ensure that first 1,000 days of life is efficiently managed.
Wow.
Because yes, it determines everything about the child.
That's the first 3 years.
No, 2 years.
2 years.
1,000 days from day one that you conceive.
Okay.
Plus till the child is 2 years old.
Matron, I'd like to ask, when does the motherhood journey starts for a woman. You know, some people would say it's the day you conceive, some people would say that it's the day you give birth, while some would say that it's even before you conceive, while you're trying to conceive. That's when the motherhood journey starts for a woman. When does it start?
Thank you, ma. Can I burst your bubble?
Please do.
Motherhood journey starts from the day you realize that you are a female.
Ow. Really?
I am a girl.
That's when the motherhood journey starts.
Your lifestyle, there are some things you start doing. Okay, I'm a female. Okay, I will menstruate. I will see my menstrual flow. I will see this. There are some lifestyles. If you indulge in them by that time, it will affect you later on in life. Now, as you gradually go, okay, you go past your adolescence. Okay, you become an adult. Okay, you get married. For instance, they always say that a pregnant woman should use folic acid. I always tell my women, if you are a woman in reproductive age, you must be on folic acid.
Whether or not you are pregnant.
You in reproductive age, because it means you can be pregnant. Okay, God helps you. Now you are married. Even if you're not ready for that pregnancy, you should be on folate, because it's actually most important in the first 13 weeks of pregnancy. Coincidentally, most women do not even know that they are pregnant in that first 13 weeks. Most women that know they are pregnant cannot even eat. They are not feeling too good. Talk more of not taking extra drug. And they couldn't drink water. They couldn't take good food. Some will be admitted and seriously, and the baby is growing on. So what happens? The supply should be available in the system so that baby's development is not tampered with. Especially the first trimester, when cell division, meiosis, mitosis, blah blah blah, it's ongoing. So that we can prevent some conditions in that
area. Okay, so a quick one I want to ask, what is the age gap for a lady to give birth? Is it from probably age 20 or 25 to probably 35 thereabouts? Because I understand that they say that when you are 30, you need to probably go and freeze your egg and the likes. What is the best gap for ladies to give birth?
Thank you. We actually encourage, there is a risky age for instance, women from 35 years upwards.
Okay.
When they are the period of giving, maybe that's when they're just starting to get pregnant, to put to bed and all. We in medicine generally we try to we categorize them as women that are at the stage of high risk.
Okay.
Elderly pregnant women from 35, especially if it happens to be the first pregnancy from 35 upwards. We have some in 40s, some over 40s. I still have them. I'm on my patient over 40s. Life happens, things happen, several things may make them, it wasn't an intentional thing.
Decision.
Good. But from mid-20s upwards, okay, there's something called ossification, complete ossification. That's complete development of the bones. It will happen immediately you are done with your teenage years. It will happen. So from our early 20s on, but at early 20s, how many women, how many ladies are really settled?
This is their school now.
Yes, thank you. Admitting us up and down. Jumping us up and down.
Then after that, you now have to choose men. The men will now come and say,
this is a generation thing.
Yeah.
That is the truth. Things happen. So all those things put together, several factors. For people, they say some people atakpata some atero for the day. And to see akpata day, if you are standing, you are rising from the rock, you can get up easily because you have good background, good solidify, whatever. Somebody atero for as you're trying to rise up, you sleep, you fall, all and all. So shakpata ni share for ni and what's our background like? Because all these things put together can aid one's journey in life.
Yeah.
But the truth is, all things being equal, if you don't have any problem and you don't have all those factors put together, it's good to have your child early enough before you reach menopause. Now we are seeing women reaching menopause in 30s.
Yeah.
I'm telling you, yes, please. 35, mid-30s, 36, reaching menopause. In those days, this would be 50, 55, 60. In fact, I'm into cervical cancer screening. I screened a woman. I just chose to ask for LMP, and she told me she saw it 2 months ago. And mama was in I think 55 thereabouts. She's still I'm telling you, when some women in mid-30s are praying, hey, this please don't stop, please, you know, and in God we have.
But for someone like that, that's in a menopause, probably 35, 36, what's gonna happen?
And there are actually medical
IVF, surrogacy, or what?
But even before that, there are actually several medical interventions, because immediately a woman enters menopause, you know, there are some hormonal that as you are not in menopausal period, there's some hormones are naturally being produced in your body that helps with all fertility and all. But when you get to menopause, you no longer ovulate, you no longer menstruate, and there's some hormonal therapy that could be done to the woman that will boost her again and make her reproductive, have whatever she needs to have before she goes into menopause completely. There are actually medical interventions.
Wow.
Yes, please.
I mean, that's great to know. But then let's get back to you know, prenatal and postnatal. You've been able to answer the question that the journey of motherhood for any woman starts the day she realizes that I am a female. You get, so it's as early as possible. You taking the right decisions and the right choices as early enough as possible. It is not when you get you know, married, or when you're trying to marry that you now start to I mean, that's good to know. Now let's talk about the common physical and emotional challenges for pregnant women, whether at the first trimester or second or third. Let's talk about the common ones that people should take note of, especially their partners. I said this because, you know, I know African men now are trying. You know, before they would say my wife is pregnant. Now a lot of people now say we are pregnant. You understand? They are trying to say, okay, we are also part of the journey. But there are still some people that are ignorant of these challenges women face, and they tend to play it down, or they tend to say, oh, you are lazy. There are even some that will tell you, my mother had 8. The world is on your shoulders and all of that. So let's speak to that, so that the men watching also can also grasp and be able to understand better that they need to be there for their pregnant wives.
Thank you very much. A number of things happen during pregnancy that a woman may not be able to predict. You won't see it coming.
Okay.
And when it comes to pregnancy, please don't ever try to compare one pregnancy to the other. For instance, you may be carrying the second pregnancy, and you're like, at least she put TB Mori. Oh, she, my dear. No, it's not so.
No two pregnancies are the same.
No, no, madam. Not even the nature of the delivery. Even to the raising of that child. Each child is unique. That is it. You may have the first child, and after 6 months, you introduce other supplementary diet, and the baby will gladly take it. You will have another child, the baby will not take. If you force the child, after eating, the baby vomits everything and return, mommy, take your food, and vomit everything back. So we always try to teach them. You will see some women in first trimester. Oh, if you try to check the handbag of a pregnant woman, and you open, immediately you open the bag, maybe you see a bottle of Martina or whatever, you think you want to try to drink. You want to drinking saliva. Because when you open some pregnant women's bag, they just carry a container around where they spit. Why some would not spit? So if a man is not understanding and is like, why are you just dragging and no? Please, you just need to understand. In my facility, we encourage the partners to come together with their wives
during prenatal.
Yes, please. During antenatal.
Antenatal rather.
We encourage them. They hear the teachings. In fact, most of the time when it's time for questions, most of that is even the husbands that ask more of the questions. We encourage your caregiver, mother-in-law, they come. I have patients that when they come to antenatal, mother-in-law, paternal, maternal, everybody, I'm telling you, big auntie, we give them seats. We encourage them to sit down, they listen, and wow, grandmothers, they will ask questions. I'm telling you, we encourage it, because you need to understand so that you don't compare your wife to anybody. That comparison alone is psychologically killing for most women. Yes, and most men carelessly say it. They actually do not want to hurt their wife's feelings, but they didn't know that they are actually hurting the woman's feelings with those statements. And the woman will now want to try to be strong. I've seen it. Everything I'm saying, I'm talking about what I've seen happen. The woman will then try to be strong. Since they started comparing her to a particular big sister, to somebody in the church, to somebody in the environment, to the point that, oh my, there are some, it could be too late, they may eventually lose the pregnancy because she just keep holding it. Meanwhile, she's having premature contraction. She's thinking maybe she's too, and at the end of the day, by the time they will be presenting, it will be too late. It will be like, what happened? You should have been feeling this pain. But because the husband is always saying, oh, in first trimester, some women will vomit seriously. There's something called morning sickness. In fact, it could be that terrible that they will experience its grandmother. And what's the grandmother? We call it hyperemesis gravidarum. That's excessive vomiting that the woman will not be able to retain anything.
Wow.
Yes, please.
Nothing in the stomach.
Nothing.
So how's the baby gonna grow?
Nothing. So such woman will need to be hospitalized. We need to give intravenous management and how to resuscitate their cells and all. And the baby is still inside growing. You will just, can you see the baby there growing? Where's the baby getting what he's eating? Draining everything from the mother. The baby is not wicked. They don't use the mouth to eat in utero. So you can't say, no, stop it. You can't beat yourself. The pregnant woman cannot do that. It's the placenta. Riser is there, it will drain, it will take everything the baby needs and supply, continue supplying whether you eat or not. And look at the mother, don't cool up, and you want to compare that woman to another. In fact, it could be so unfortunate for women that have both the baby and myoma, fibroid, inside them. Come and see massive discomfort.
That's a complex one.
Massive discomfort. So such women, you can't, no, you don't compare. We rather appeal to our men to please be knowledgeable. If you have a facility like just as I said about house, go join your wife. Go once in a while, take permission from work. If you have break, one public audio or whatever, it's coincide with antenatal day. Ensure you go with the woman. Listen, ask questions. So some vomit, some swollen foods. Some you will see some women's nose. It will be like times 4. You see some, a number of things. Some gradually become hypertensive towards the end of that pregnancy. In fact, when you get to last trimester, everything about you changes. Everything. You're walking, your gait, you just turn to letter S. Your stomach shooting out, your back, everything curved in. In fact, you can't maintain your gait again. You want to, to stylishly walk and do something. You just see that frequent urination, which could interfere with your sleep at night most time, and it's not your fault. The effect of the hormones, especially if the first trimester, the woman goes to pee a lot. Men, we need to just understand with the woman. I always tell them, my auntie, well, tell your husband, my dear, let me sleep at the edge. Because you will get up several times before daybreak to use the restroom. And one of my patients complained to me in the Matron, can you imagine what happened? She said at some point when she was going back and forth to use the restroom, when she comes back, she will meet the husband on the bed snoring. She was angry that I'm going and coming, you are sleeping. When the husband woke up, the next thing he said was, my dear, please open the door. Your door opening is disturbing my sleep.
Are you serious? And I'm carrying your child here.
She couldn't sleep. She was heartburn, muscle cramps, all those things, going to pee. And the only thing you could say is that your door is disturbing me. Sincerely, we need our husbands to be more knowledgeable to understand, so that they can know that woman is not faking it. A number of things there are days you wake up, we call it surge of energy. You wake up, it's as if you swallow up and then yam over the night. You have their extra strength to do everything and anything. In fact, your wardrobe that is well arranged, you will go, you will rearrange, you will do this, you will do that. And there are days you wake up, you are looking like Lucozid. Your husband even asking, my dear, what's happening?
I don't know.
And the truth is, she doesn't know. She doesn't even know how to explain herself. Have you seen women that they don't just like how they are feeling? How can I just sit and just... Have you seen pregnant women finish eating and stays glued to the seat to get up to even pack their plates? And for instance, coincidentally, funny enough, they can sleep off right there. And this is even common in last trimester. A particular hormone is released in their system called relaxin to just relax everything. Their ligament, everything is just relaxed. They just... And there are days surge of energy, so we need to understand these ups and downs when the hormones are shooting up, and the way it will display in a woman, in this woman may be different from that. The way it will display itself in the first one may be different from the one it will display in the last born. That is it. This understanding needs to go around. Yes, you will keep comparing women, and it will gradually be affecting them psychologically and emotionally.
Let me digress. Let me bring in some humor here. Yes, what about the cravings? Because some men will tell you that women do this on purpose just to make them suffer. When a woman will tell you, I want to eat rice, I don't want rice that is served in the restaurant. Go and look for rice that you're not
going to tell you your neighbor's food. I won't see that.
So are these things, are they real or women just make it up?
Let me tell you this. It's pregnant women that knows the difference between the taste of wedding jollof rice to birthday party jollof rice, funeral jollof rice. Mention it. Pregnant women knows the difference. And thank God for this hormones. So sincerely, that thing is real.
Really,
real. You may feel like eating a particular type of meal, and you go to the market yourself, get the ingredients, you make the preparation, and the food is ready. You actually crave for this food. Lo and behold, forget it. It's everybody in the family that will eat the food while you are looking at them. You just taste a little and that is all. And you're wondering, what is happening to me? I felt like eating this food. And coincidentally, another person eating another thing. Just the sight.
Yeah.
Or you just perceive the aroma, just like,
I want this.
And you just begin to. You may see a small child holding papa and just, hello my baby, God bless you. You are trying to, establish relationship. And after like, papa, if you do abi, show me. Okay. Please, where did you get it? And you may pick your phone. Hello, my dear. I've seen mothers like that. They come to antenatal and they just see somebody eating. And they, hello, my dear. Please, I feel like eating so rice. Please let me get it. So thin. Yeah. And they will get it. Lo and behold, before they get up, before the husband brings it home. It happened to one of my sisters. She just called me and said, Auntie Motirogo, what did you do? Only I feel like taking snail pepper soup. The husband happens to be a banker. Only and I called my husband. She works from home. I called my husband to get me. So the husband already ordered for it. She said, Auntie, hey, they are almost here. I don't feel like eating it again. Money, what do you want to get another one next time? If you want to, money, I understand how you're feeling. You know what? Just have a taste. Keep the remaining in your freezer. Money, but that you will not eat it at all, taste at all. You will discourage that man, no. But only kilo shaming share. You are cooking no man. It's not. The woman is not even able to explain herself. Well, I was checking through my phone because in my place of work, we have a platform for pregnant women. Okay. Where we, and we have a platform for the nursing mothers. When you deliver, we move you there and we continue with your management. It's not a one-time thing. And I saw on the status of one of them, please, where can I get ofada rice? I just saw it on her status. Then I private chatted and I started laughing. I said, Pele, it's pregnancy hormones. Before being pregnant, she doesn't take ofada rice. So. Interesting. She's not used to it. But now, one of my lecturers gave an instance that sometimes she went to the market with her husband to shop. And do you know that a lecturer, she said when she got to her customer, the husband was waiting for her in the car. Instead of her to, she saw somebody hawking, this rice they make and put inside the leaf, rice they ate rice at home. But she got to the market, she saw she saw that green leaf and she called she bought. If she would have bought a well-learned fellow, a lecturer, she would have bought it and taken it home. She said she sat down right there and ate it. Took her customer to give her water. She washed her bare hands. And my mom started eating right from there. At some point when the husband didn't see her on time, so he alerted from the vehicle to come and check. Lo and behold, when she got and saw
I can't imagine sitting down,
she just said, she said she was ashamed of herself, but the husband understood. No. No. She was, so she said she just managed, finished the sentence and went to put my dear, sorry, no, don't worry. And this one understood that, no, you don't fear at that time. Can all our men understand?
Wow. So I've always thought that some of these cravings are made up just so because the women want to also make the men know what they are going through. They say I'm the one carrying the child and all of that.
You can just have that passion. When I carry my first one, I always want pap and moi moi every night as dinner. Pap and moi moi every and every evening my husband goes out, he gets it. I remember when I put to bed, that mama only rushed to our house. She came to, it happens. The other part is the one we call piker. That woman craving for something that are dangerous. That's when we now try to, that's when we now try to encourage the mothers to be careful. Some can just feel like leaking cement.
Or eating wood. I think
eating wood.
Yeah.
Taking sound. Potash, you know potash, corn.
Yeah. Yeah.
I just feel like licking corn. I just feel like licking Maggie. You know, something that is odd. One chatted me and said, Ma, that day there was rain. So immediately after the rain, she said, I feel like going out to lick the fresh, the odor of the. I love the scent, the sound is bringing for the aftermath of rain. My dear, I just started cancelling her. I knew how she was feeling. So when it gets to that, we try to help women. Don't let them feel as if am
crazy.
I mad? Is something wrong with me? No. Try to teach them what it is. We always, in fact, before you experience it, we ensure that we teach you, so that by the time you're experiencing it good, so that we can try to balance things. So we're not making it up.
All right, so men out there, you've heard.
I beg you.
If your woman wakes you up 12 a.m. and then she wants suya, run and go and get
by the time you return, and she says she knows suya must have been done.
Try and understand. And please, women, don't overdo it. You know, it can also be frustrating for men when they say get me this and they get it, and before they come you say I don't want that one again, I want another thing. Now let's move into another topic, which is the issue of vaginal delivery and cesarean sections and all of that.
All right.
Because I have heard, and I know you also as a health practitioner, you must have heard experiences like this where people look down on women that go through CS to have their delivery, because they tell them they are not woman enough. They say, be more the right way, like you did not have vaginal delivery, so you are less of a woman. I've heard of people that their in-laws gave them hell just because they decided to go through cesarean section. They say they are lazy.
But you know that there are some people also whereby they prefer their I've seen a man, it was like he does not want his wife to actually give through the vagina, just through the CS of a thing. So which one do you think is preferable? What do you think about it?
Thank you. I love this aspect, this question so much. And I don't joke with it when I want to teach it out to my patients and wherever I find myself. Do you know the problem? On this question, women, we are the problem of ourselves.
Oh.
Sincerely, I give it to the men out there when it comes to this. It will always be the woman gender condemning another woman. It's real. I'm trying to remember. I'm not sure I can recollect any now that to be the man. No. In fact, some men will be like, just as you said, I've had them a number of times. Is this what labor pain
is?
Oh, no. If this is it, please, after this woman is not going through. In fact, some be like, please, can we just end it here? Can this woman be taken to the theater? Most of the time, the men do not have any problem with this. But women, women, please, can we just understand that? The truth is this. With the way God made us, it is not every woman, medically speaking, it is not every woman that will be able to have vaginal delivery. Let me not delve into details. Let me just spare that details because it's a broad thing on its own. Due to several factors, a woman may not be able to have vaginal delivery. Now, for women that are even fit for vaginal delivery, due to several factors, they may end up having cesarean section. So the question I always ask is this: which one is the best? Should we go in for a C-section and have healthy mother and healthy baby? Or do we forcefully go for vaginal delivery and have a mother but the baby is gone? Or coming out with an unheard mother? Yes, because the woman can be injured. There's something called VVF, RVF, vesical vaginal fistula, rectal vaginal fistula, that the woman will be draining urine. Urine will keep coming out from her vagina, not the urethral tract, from the vagina all the days of her life, except surgery is being done. There are some woman will pass a fecal matter from my vagina just because of the injury she sustained during vaginal delivery. God will just have mercy on us. But the truth is this: it can happen. Things can happen. For instance, I have only several. Which one will I talk about? At time, all along the baby had been head down, and at time the baby just turned, sat down
like this,
and the baby refused to. Some will just turn transverse. So how will that woman deliver such a baby? We just so does the woman several. There was a time some years back they referred the woman to us after she too ran away, but by the time they brought her, death by hanging, baby had already died in her yes place. I didn't mean that the baby was even breech or whatever. We could have managed the delivery, but the baby was transverse. Big baby. We had to enter the theater to bring out a dead baby. Please, who gains? No. Who gains? We need to teach our women. We need to create that awareness, and the religious setting should help us. Please help us, religion, our imams, our pastors, our leaders. Please help us, because at the end of the day, by the time they get to church, get to mosque, get to religious places, and start to share testimony, can a spiritual leader, can a religion leader correct that woman or that man? Because it with that statement alone goes a long way. You have sown a seed in their subconscious. True. And it goes with every woman. They say, hey, help me to thank God. Oh, the doctor said I would do this session. I pushed my baby out by myself. Thank God with me. Oh,
I delivered like the Hebrew women.
I mean, which one is Canaanite? I don't know. We need to just put this together, and you have your baby, you have your life, you are healthy.
That's testimony.
You are a Hebrew woman.
That's testimony.
But until somebody rises up and correct that statement, in fact, they will now begin to look at nurses, midwives, doctors like devils, like demons that want to disturb the whatever. Oh God. I can't even be talk example several that eventually we lost a baby. And somebody me o shashe danu. That's what I was telling. I me o shashe danu. Lord, I don't want you to shashe danu too. I don't want you to waste that period, the 9 months, the stress you wallow the soul. No matter what your husband gives you, no matter how he stays there with you and for you during the period, you are the one that knows the stress of this thing. And at the end of the day, you don't have anything to show for it. Who does that? Can we just be on top of the game? I've shared this before. A pregnant woman that I conducted her delivery, I made the baby. She delivered the baby. She just said, thank God. She's an able woman. She just put it in her language. I'm not
thank God I am now a woman.
Then I looked at her. So, and that was the second child. Then I had the full gist. The first child, because she has a single session, the story is still on the table.
Nah, that's so
yes,
wrong.
The mother-in-law, the sister, the big sister. And please, can you please stop comparing a pregnant woman to another one? Keep telling them, every, and you begin to glory in what is not, what could claim and that testimony. Some women will listen to that. Something has been deposited in their subconscious, and they want to try it out. And they try it out and meet their Waterloo. I'm telling you, some they wouldn't rush them, but then we rush them out. You see women that in their own blood. No. It's a lot. So I always say this and teach this. And do you know that as we teach, I love to teach it. I love to create that awareness, because the truth is, gradually we are sowing some seeds and it's helping some women. Now we see women come out, but by the time the baby is too big and they have some conditions. In fact, as the doctor is counseling them for cesarean session, in fact, they'll be the one to say, please, when is the right time to have the C-section done? Because I've seen women do that now. I've seen husbands do that. I've seen mother-in-laws do that for their daughter-in-laws, because they are knowledgeable. Knowledge is power. Let's equip our people with knowledge. Let them be aware. Let them have the right understanding. And let's stop losing lives of women. So many women are out there. You don't know what is underneath them. Some are on diapers just because of this forceful delivery, but you would not know. Yes, please. Some lose the use of their limb just because of this forceful whatever. A number of things, but you would not know. You don't know their story. Now people are even afraid to say, oh, I did CS. And please, what concerns you? It's common in African setting. Congratulations. After they ask, Akombabo, is he a boy or a girl? Please, which one is not a human being? And after that, let you know. She normal delivery? Is it normal delivery? Please, which one is abnormal delivery? Even if you like, clean your ear and bring out the baby from the ear. I'm fine. Just give me a healthy baby and a healthy mother. Can we stop these two questions? Akombabo, is it a boy or a girl? Is it normal delivery? Which one? Which one? Hey, my good God. If they have seen complications of delivery before, Oh, they will thank God for every woman that goes into delivery room or theater and comes out fine without asking for the gender. Like, yeah, show what other, show me what other. Mama bell on they won't even remember to ask for the gender if they have ever seen one complicated delivery. God help us.
Well, you know, like you said earlier on, in this issue, it is mostly the female gender that drive this narrative. They drive the narrative.
They believe that what I've been able to do,
yes,
you should be able to.
I mean, they'll tell you, I gave birth 8 times through vaginal delivery. Nothing happened.
And the olden days also, there's no serious.
They will forget that the physiological makeup of each. That is it. That's the truth. Yes, we all have. Permit to say, okay, we have our boobs, we have this place. The truth is, all those things I just mentioned, they're actually different from one woman to the other. Yes, please. Let 5 women remove their clothes, stay in front of mirror.
Yeah,
look at, you will see. I know what I'm saying. Same thing with the man's manhood.
Yes.
Yes, please. Yes, they all have same, okay, but everybody stand in front and see.
They're different.
When it comes to size, when it comes to shape, when it's got a number of things. So, in some ways. Oh, I pray God help us. But the truth is, in those days, a number of things too happened. But because we were not enlightened to know what, for instance, in those days, there's some women that will just lose their pregnancy, they will lose their all. And a number of things. But medically, by the time we do our test, we now realize that, oh, the woman has also condition in the blood. But not because Oju research is ongoing, people are gradually becoming enlightened, they can easily understand the cause.
Yeah, but there's this thing. The person that actually said, I don't want my wife to give birth through vagina and all of that. He was of the opinion that if she should give birth through C-section, the shape of the vagina would not be different. It would still be intact. That was his own opinion, that he always wants his wife to give birth through CS. Because the third child, the woman was like, hey, I want to try and give birth through vagina. She, like, I've heard a lot of stories, people in church, and he was like, no, I actually want you to do that. And he was confiding me, like, this is why I actually want this woman to give birth through CS. And I was like, what happens to the vagina after giving birth?
Thank you. During the second stage of labor, when the woman will need to push out, everybody knows the size of the baby, at least no matter what. Even if it's a small baby, okay, 2 kg, 1 point something kg, the baby is bigger than that. But at that stage, there will be stretching.
Okay.
The muscles there will stretch out, elongate and all to accommodate the baby as the woman pushes the baby out. In the process of women, we have lacerations. Some we need to give a surgical intentional cut, which we refer to as episiotomy, so as to widen the pathway. So immediately after this, we repair.
Okay.
When we repair, we are safe. The thing will return to that state, and based on the number of passengers that will pass through that passage, it can bring about widening. But there are also ways out to help. Maybe it's just to continue to enjoy your partner, to ensure that your mathematics, nothing affects it.
Yeah.
Problem. There are a number of things that could be done. That's why women need to be knowledgeable. Most of them don't attend postnatal clinic. In fact, in this African setting, most people don't know anything about prenatal clinic, postnatal clinic. What they only know is antenatal.
Yeah.
And it's not even that antenatal, not everybody attends. They be like, she might be more antenatal clinic, you are just wasting your money in the hospital and all. In fact, in that one, we have not even had 100% of women using that. How much more postnatal? Most people don't know it. So the number of things, I just told you now, Ogoji Ojo, 40 days, that's 6 weeks, that's the period we call postpartum. The number of things to put in place to help that woman and the baby. Because so many women actually get confused at the early stage of postpartum. My baby does like this. I think is having so much pain. My baby will do like this. Do this. Do this. And incision. And meanwhile, all those things are normal reflex responses. A newborn should be able, we call it moral reflex. When there's a sound, bang, and a newborn is around, baby will, they should be able to fan out, and next thing, they may cry. You see, a newborn wants to pull, and they're like, And the mother like, lemon D, constipation, jedi. And but me, if you attend postnatal clinic, all these things will be ironed out. You understand why your baby is doing this. You understand the period your baby may not sleep too much. Okay, why is baby not sleeping? Okay, what can you do? And little thing they say, you know what? And you see mothers they deliver, and they call it in Yoruba, they call it ajogba.
Yes.
A container where all forms of drugs are inside. Yeah. A baby that is sucking where they will put multivitamin. A baby that is not having fever, they will put paracetamol. They will put all these antibiotics. A number, I don't want to be mentioning names. Yeah. A number of antibiotics, this and that, for stomach, for this, baby is having menstrual pain. They put drugs. They just combine everything together and begin to bombard the baby's liver and the kidney. You don't know that all this thing you are giving to the baby. You are just stressing the baby's liver and the kidneys. All these are not important and not necessary. Where will they learn that? Postnatal clinic. Okay, when will my mercy stop? I'm still seeing blood though. Is the blood too much? Is the blood normal? You will learn that in postnatal clinic. Okay, when am I fit to resume intercourse with my husband so that the problem will not start again at home? Postnatal clinic. How many women go to postnatal clinic?
Yeah.
And those that are ready, they won't go. The only thing that will take them to the hospital again, immunization. That is not the postnatal clinic. The postnatal clinic is actually meant for the woman. That's what we examine. As involution taking place, that is, as uterus return to the pre-pregnancy state, which is inside this bone, the pelvic girdle. For women that have CS done, how far with the upside? Hope is not draining. Is it fine? Is it? A woman chatted me up a few weeks into delivery, and she said, "Hello, ma, can I start bathing?" So you've not started. He said, "I've not started." They say, once a man, can I start taking milk? You are not taking. Man.
Knowledge.
Speaking about that bathing of a thing, I remember there was this thing about they called probably all these mates of Olomitutu that don't use hot water on the baby. The mother too should not use hot water to bathe or probably do anything with the baby. How true is that?